I'm Dr. Lorraine Muluka. I'm an obstetrician, gynecologist, born, bred, living in Kenya. And I basically do both obstetrics and gynecology. So I'm in the arm of delivering babies and also dealing with women's health. And I'm a champion for women's health. So I'm really big about health education. Typically during pregnancy, because you're still pregnant, most ladies notice that sometimes they are experiencing periods of extreme sadness. So you could just start crying, and it could be the littlest thing, smallest thing that tips you into, you're bawling out your eyes. And then you can also notice that sometimes, in this space of time when you are having this mood, you're not eating well, you're not sleeping well. And then sometimes it's just a lot of anxiety. You're like, I'm pregnant. What should I expect? And, you just think that you may not be able to cope. So that's what typically happens in the pre-delivery state. Now, once you deliver the baby, there's a social expectation that you should be a happy mom. The baby has come. It's called a bundle of joy. So you should be like over the moon. But in that space, the ladies are sometimes still, they feel like this is, you're having almost an out of body experience whereby they're not like feeling like they can connect with the baby. And then they also feel like they cannot be able to cope. And then some of the other things that are also associated with the pre-delivery states are there. You're extremely anxious, but now you're also now sometimes extremely worried about the baby. You keep checking on them like every second, thinking like, are they alive? Are they breathing? So there's a lot of uncertainty, basically, and a lot of sadness and a feeling of hopelessness and helplessness, basically. So the first thing would be to, one, create awareness, and just for women to be able to pick this up that, hey, I'm feeling out of sorts, but maybe it's a bit too much. So the first thing, it always begins with identifying that there's an issue, because many times it's missed. And there's also a phase that we call postpartum blues. That's like right after you've delivered, you have this period of almost symptoms similar to this, but with the depression, they tend to prolong. With postpartum blues, typically in the first 2 weeks, you get the hang of it. It's a new baby, I'm not sleeping well, this is what happens. So the first thing is being able to identify it. And once you identify it, then you can ask for the kind of help that you require. And this could be just starting to talk about it, having conversations about it with the people around you who you can trust. And then the next step would then to be able to see your obstetrician. So that would be the doctor who walked the pregnancy journey with you. And when we see you, we're able to assess you and decide that this looks like it's now actually postpartum depression. And from there, we then link you with the right channels, which are usually in terms of therapy, because there's a lot of therapy that's then needed. So there's either like personalized therapy, you and your therapist, and then there's also group therapy where you see moms are going through this, I'm not alone. So this is part of the treatment process. And then there's also treatment with depressive drugs. We tend to think that it will happen maybe in the delivery, or it happens like in the first 6, typically called the postpartum period. But it's been shown that it can actually happen up to 1 year after delivery. So it's something that women really need to be educated about, because maybe if it happens after the first 6 weeks, mom may not realize that that's what she's going through.